I mean, what do you see in the difference between real world data versus what we see in clinical trials? Because that's a real disconnect, I think, sometimes.
Sure, it is a major problem. A number of studies have shown that people don't take their medications for chronic disease, including people who have had major events like a heart attack. After a year or two, they're not taking their statins and often not taking their ACE inhibitor and aspirin. And I think we need to keep emphasizing the importance of these therapies to patients when we see them.
And so there's been some real world evidence by Pratley and others that looked at the disconnect between clinical trial and real world results. And we looked at reduction in A1Cs with 2 doses of liraglutide, both 1.2 milligrams and 1.8 milligrams, both at 6 months and at 12 months follow-up. And so in the clinical trial, it's a minus 1.2% reduction, a minus 1.5% reduction at 12 months, a minus 0.8%. Minus 1.1% reduction. But if you look at that same time frame for a variety of GLP-1s in the real world setting, you know, the reduction at 6 months was minus 0.9% and minus 0.7% at 12 months. And again, if we look at the disconnect in that same clinical trial about the percentage of people achieving an A1C goal at target, you know, it's 44 and 56% at 6 months, and it's 43 and 51% at 12 months. But in the real world setting, it was only 31%, and it decreased down to 26% by the time the 12 months is up. So again, clearly it's about persistence and adherence, because it's not that the medication isn't working less well, it's that that patient is likely not getting the same sort of clinical trial support that they would be in a setting where they have regular interaction with that team member, they're coached, they're cajoled, they may be getting the medication for free. In fact, there are a couple of studies looking at both sulfonylurea, TZDs, DPP-4s, and even basal insulins that show that they're well below 50% refill persistence over 18 months. And so I think that's for us in the office is the issue is really trying to ask those open-ended questions like, okay, you're on a difficult regimen. How many times do you miss an injection, or how many times do you miss a pill, or do you have trouble affording your medications? Because that's a conversation we're having now a lot with our patients.
I agree with you. There's one additional thing that we should be talking about, and I'm sure we will today, and that is related to strategies to make the treatment easier,
right?
Particularly when it comes to injectables.
Right, I agree with you, and we've got a lot of options, and we'll talk about that. The other thing is that we know that the failure to adhere, the lack of adherence, the failure to persist on a medication is associated with, increases in A1C, increased risk for, complications and those types of things. So I think it's important as we, talk to our patients that we try to spend a little more time at the first part of that office visit understanding their medications, their medication lists, their challenges, and asking those sort of open-ended questions and do some real active listening.